Hi, so I'm Bree and I'm a new member of the Craven SPORT Services team. So I want to take this chance to introduce myself and to tell you about the type of work I do. So for 17 years, I've been working in the area of pelvic health. So what exactly does that mean? So if we look at the pelvis, you can see that the sides and the back are all bone. If we look at the underside, it's only muscle. There's no bone underneath our pelvis. So this means that over time, there can be strain or weakness or pain that happens. So these muscles are doing a job for us all day long. The only time they really fully relax is to let us empty. Otherwise, they are always working, even when we are asleep. So what type of patients might come to see me? The most common I see would be a man or a woman who might be having trouble emptying or controlling their bladder or their bowel. So that would mean I would look a little more closely at this outer layer of muscle that helps to pinch things off and keep things controlled. The deeper layer on the inside is part of our deep core strength. So I look at this for women that might be having heaviness or pressure from a pelvic organ prolapse, which means their bladder or their uterus or their bowel has fallen out of its original position. I will also look at this area a lot for my athletes who might be doing high impact or heavy lifting activities that can create strain or pain. So I'll look at their pelvic floor strength and then we'll add it into their core activities so that we can enhance their performance and their function with their sports. I often see women who are pregnant and might not be having symptoms yet, but are wanting to come for an assessment. So leading up to their labor and delivery, they are strong and active. I then often see them after, in their postpartum stage, to check for a diastasis recti, which is a separation of their abdominal muscles, and to check their pelvic floor to see how their strength is and to see if they're having any pain that might have resulted from their delivery. I might even see people who've heard about pelvic floor physiotherapy or heard about Kegels and aren't really sure what it's all about. So I can do an assessment, we can discuss and educate them about their bodies and ensure that everybody is getting optimal pelvic health. So stay tuned, we'll be doing more videos on pelvic health at Craven SPORT Services.